How does principlism compare to casuistry in bioethics? Imagine you're faced with a tough healthcare decision. Do you rely on broad rules or look at each case individually? That's the core difference between two major approaches in bioethics. Principlism and casuistry are both tools that help us think through moral questions in medicine, but they do it in very different ways. Principlism is built on four main ideas: autonomy, beneficence, non-maleficence, and justice. These are like guiding stars that help shape decisions across many situations. When a dilemma arises, principlism suggests balancing these principles to find the best course of action. It's a clear, structured way to apply ethics universally, making it popular in hospitals and policymaking. Casuistry, on the other hand, is more like solving a puzzle. It looks closely at specific cases, comparing them to similar situations that have already been judged. Instead of starting with broad rules, casuistry examines the details of each case to see what fits or doesn't. It uses analogy and practical judgment, which means it's flexible and adaptable to real-world complexities. For example, if a patient refuses treatment, casuistry would analyze that case by comparing it to past cases with similar circumstances, rather than just applying a general rule. This makes casuistry especially useful in clinical settings, where each patient's situation can be unique. In healthcare today, principlism provides a consistent framework that helps doctors and ethicists make decisions based on core moral values. It's often used in developing policies or ethics training because it offers a straightforward way to think about right and wrong. Casuistry complements this by helping healthcare providers navigate tricky, real-life situations where rigid rules might not fit perfectly. It allows for more nuanced judgments based on the specifics of each case, which is often what happens in hospitals. Some people see principlism and casuistry as rivals, but many believe they work best together. Principlism gives the moral foundation, while casuistry offers the practical judgment needed to apply those principles in real life. Both approaches value moral reasoning and practical wisdom, which are vital in healthcare. So, in simple terms, principlism is about broad rules guiding moral duties, and casuistry is about detailed case analysis that considers the context. Together, they help shape the way ethical decisions are made in medicine today.